Hi everybody, Dr. Sean Casey at Healthcare Complete Back and Neck Pain Center answering your questions. Had a really good one come across our desk the other day, which was someone asking about how chiropractic can actually help heart function. A lady had her husband having some heart issues and was looking for different ways to help improve both their healths. And it's a great question because chiropractically can do a whole lot to actually improve your health when it looks at the cardiovascular system. We always think of like chiropractic for joints and back and nerve dysfunction, but remember, if there's irritation in those nerves control everything in your body, including heart function. Now, one of the big things we look at when we've seen the research on this, we know that chiropractic care can help reduce stress, improve circulation, improve respiratory function. Because if you're not able to breathe efficiently and cleanly, that heart has a whole lot more work to do, so it can reduce the stress that way. The other big one we see quite a bit of is the autonomic nervous system getting balanced out. So think of the whole fight or flight mechanism. The other part of that is rest and digest. Well, if your fight or flight mechanism is constantly firing, you're constantly stressed out, that heart rate's always up. They can actually lead to AFib and some other big cardiovascular issues as well as high blood pressure. So we found by doing some things to correct that, to basically remove nerve interference that's impacting that part of the nervous system, research shows a whole lot of health benefits for the circulatory system and heart function. On top of that too, pain. We know that pain's a big factor with a lot of issues, and wherever the pain's at in your body, that's going to increase stress and some wear and tear on the heart as well. So over time, the heart's a strong muscle, but damage occurs with that constant stress on it, just like any other muscle that you can overtrain or overwork. So yeah, there's a whole lot we can do chiropractically if that's part of the component. Now that said, we also look at things from a chemical standpoint, from a diet, nutrition standpoint, and also, getting some work and a good evaluation with a good cardiologist to make sure there's no other factors going on that need to be addressed. But yeah, if you have some questions about that, give us a call at the office. We'd be happy to help out. Have a great day.